How do UTIs develop in the bladder? Imagine bacteria as tiny invaders trying to sneak into your body. Most urinary tract infections start when bacteria from your gut, mainly Escherichia coli, find their way to the opening of your urethra. The urethra is the tube that carries urine out of your body. When bacteria contaminate the area around the urethral opening, they can enter the urinary tract. Once inside, they begin to travel upward into the bladder, which is a hollow organ that stores urine. Bacteria use special structures called pili and flagella to stick to the lining of the bladder, known as the uroepithelium. These structures help bacteria cling tightly so they don't get washed away by urine. Once attached, bacteria can multiply and form colonies on the bladder wall. Some bacteria even invade the cells lining the bladder, hiding inside them in tiny communities called intracellular bacterial communities. This allows bacteria to evade the immune system and antibiotics, making infections harder to clear and more likely to come back. The bladder lining isn't defenseless. It produces antimicrobial peptides and signals that call immune cells to fight off invaders. It can also swallow bacteria into vesicles and expel them during urination. But some bacteria have evolved clever tricks to overcome these defenses. For example, they can neutralize the enzymes inside immune cells meant to destroy them, allowing the bacteria to survive longer inside the bladder tissue. Several factors can make developing a UTI more likely. If the protective mucus layer on the bladder wall gets damaged, bacteria can more easily invade. Changes in urine, like pH or urea levels, can weaken its natural ability to kill bacteria. Activities like sexual intercourse, use of certain antibiotics, having diabetes, or other health conditions that impair immune function or bladder health can also increase the risk. In terms of bladder health and bladder cancer, repeated UTIs and ongoing inflammation caused by persistent bacterial presence can damage bladder tissue over time. While research is ongoing, chronic inflammation may play a role in increasing the risk of bladder problems, including cancer, but a direct cause and effect relationship has not been definitively established. In summary, UTIs develop when bacteria from the gut travel up the urethra, attach to and invade the bladder lining, and then multiply, causing inflammation and symptoms. Protecting bladder health involves supporting your body's natural defenses, practicing good hygiene, staying hydrated, and addressing any health factors that might increase your risk. If you suspect a UTI, it's important to see a healthcare professional for proper diagnosis and treatment.